Back here in the U.S., the CDC reporting an increase in norovirus cases across the country, the highest number of cases showing up in the Northeast. New York City and Philadelphia, the hardest hit norovirus.
Imagine being stuck in bed for days, unable to keep anything down because of norovirus. How can you protect yourself from this miserable experience? Hey there. Welcome back to the channel. Ever heard of noroviruses? I've spent hours studying the latest data on norovirus transmission to bring you the most effective prevention tips. They are a bunch of viruses that can make your stomach and intestines all inflamed, which leads to what we call gastroenteritis. Now, gastroenteritis might sound like a mouthful, but it basically means your tummy and gut are all upset, making you feel really sick with sudden bouts of heavy vomiting and diarrhea. The good news? If you're generally healthy, norovirus sickness usually doesn't stick around for too long. But there's a catch. Young kids, older folks, and folks with other health issues can get hit harder and might stay sick longer. Here's the thing about norovirus. It's not like a bacterial infection where antibiotics can come to the rescue. Nope, noroviruses just do their thing without caring about antibiotics. Now, here's where it gets tricky. Norovirus is a speed demon when it comes to spreading. Places like hospitals, nursing homes, daycare centers, and schools are like hotspots for norovirus outbreaks because people are all up close and personal, which makes passing the virus around super easy. So, what's the takeaway? Wash those hands. And if you're feeling under the weather, do yourself and others a favor, stay home until you're feeling better. Let's keep those noroviruses at bay. When you catch norovirus, it's like your body goes into panic mode. You might feel super nauseous, start throwing up, and have a serious case of the runs. Plus, your tummy might cramp up, and you could even get hit with a low-grade fever, chills, headache, muscle aches, and feel totally wiped out. For the majority, this unpleasant bug doesn't linger. Typically, within a day or two, symptoms subside, and there are usually no lasting health concerns. However, it's worth noting that children often experience diarrhea more frequently, while adults may endure more vomiting episodes. But hold on a sec. There's more to it. Sometimes, especially if you're tossing your cookies and hitting the bathroom nonstop, you might not be able to drink enough to replace all the fluids you're losing. And that's where dehydration swoops in, a fancy term for losing too much water from your body. Dehydration comes with its own set of warning signs, like peeing less, having a dry mouth and throat, and feeling dizzy when you stand up. When things get serious, you might even need to hit up the hospital, where they'll hook you up to an IV to pump fluids back into your body through a vein. So, if you ever find yourself in this pickle, don't hesitate to get the help you need. Norovirus is a sneaky little bug that hangs out in the poop and puke of folks who are infected. And let me tell you, it's a real speedster when it comes to spreading, especially in places like hospitals and healthcare facilities. So, how does it hop from one person to another? Well, there are a few ways. Direct contact. If you come into contact with someone who's infected, whether it's a healthcare worker, a visitor, or another patient, boom, you could catch it too. Contaminated food or drink. If you chow down on food or gulp down drinks that have been tainted with norovirus, guess what? You might be in for a rough ride. Dirty surfaces. Norovirus loves to hang out on surfaces and objects. So, if you touch something that's been contaminated and then forget to wash your hands before digging into a snack or meal, well, you get the picture. So, what's the moral of the story? Wash those hands like it's going out of style, steer clear of dodgy food and drinks, and keep your mitts off anything that looks suspiciously germ-covered. Let's keep that norovirus on lockdown. When it comes to preventing norovirus from spreading like wildfire in healthcare facilities, there are some key steps to take. Isolation. Patients suspected of having norovirus may be kept in private rooms or grouped together with others who have the same infection. This helps stop the spread. Hand hygiene. Wash those hands like your life depends on it. Follow the hand hygiene guidelines, especially after being in contact with someone with norovirus. Soap and water are your best buddies here. Protective gear. If you're taking care of someone with norovirus symptoms, suit up. Wear gowns and gloves to shield yourself from the virus. Clean, clean, clean. Keep those patient surfaces and equipment squeaky clean. Regularly disinfect high-touch areas with products that the Environmental Protection Agency says are good for killing norovirus. Laundry duty. If clothes or linens get contaminated, don't panic. Just remove them and give them a good wash to banish any lurking norovirus germs. Sick leave. If you're a healthcare worker and you start feeling like you've caught the bug, it's time to take one for the team and stay home until you're feeling better. By following these prevention measures, we can help keep norovirus from wreaking havoc in healthcare settings. Let's stay vigilant and keep our patients and ourselves safe and sound. Thank you for tuning in to the Health and Wellbeing channel, where we're exploring everything you need to know about norovirus, from symptoms to treatment. Remember, knowledge is power, so stay informed and keep advocating for your health. Until next time, take care and stay resilient. Don't forget to ring the notification bell, subscribe, and like so that I can produce more videos on health topics like norovirus. Till then, goodbye.